Welcome to PHARMATIVE Live. I'm Dr. James Partyka. I'm a clinical pharmacist, oncology research scientist, and the founder of PHARMATIVE. And this is PHARMATIVE Live, coming to you live from Palm Springs, California. PHARMATIVE Live is sponsored by Pride Nation Radio. Pride Nation Radio is the #1 streaming dance music station in the nation for the LGBTQ community. Not only is it great music to dance to, but it's also great music to work out to as well. And you can get Pride Nation Radio by just typing in pnn.fm into your web browser or pnn.one. There's a really easy to use pop-out player, so as long as you're on your phone, tablet, or laptop, you can listen to some great dance music, which will cheer you up and also perhaps allow you to have a better workout as well. That's Pride Nation Radio at pnn.fm. So today's topic is that I'm going to give you a brief update on the COVID-19 pandemic in the United States. Now, I realize a lot of us are probably well informed, but there is some additional information that you should all know, and you can obtain additional information by going to our Pride Nation Online Plus Health magazine, which is available at pridenation.com, and look for our feature article that will even give you more additional information. It's a short article, brief and to the point, so that you and your family members can be informed and updated on the pandemic. I also have just recovered from COVID-19 disease, so I'm going to give you a self-report of my own case study of having COVID-19 and some of the things that I did to relieve my symptoms of COVID-19 disease, and I'm going to talk about that a little later on. So again, let's provide an update on where we are with COVID-19 pandemic in the United States. As of August 26th, there have been 93.9 cases of COVID-19 disease reported. And unfortunately, there have been over 1 million deaths of due to COVID-19 disease. Both of these statistics are underreported because not all deaths and not all cases have been reported into the CDC. So again, that's a huge number. And again, it's a number that is still climbing. So that's why we're having this brief COVID-19 update. And I want to shout out to Thea out there, Jimmy, Alan, and a number of friends out there. This is PHARMATIVE Live, and we're coming to you live from Palm Springs, California. Now, when we talk about vaccination, 67% of people in the United States are fully vaccinated. That's 67%. 79% of people in the United States have received one dose, and only about a third, 32% of people in the United States have received their booster. Now, a fact that you should remember, when you're vaccinated with COVID-19 vaccine, you are only obtaining immunological protection against the virus for approximately 4 to 6 months. Again, so those vaccines wear off with time. Now remember, the vaccines produce the antibodies that attack the spike protein on the virus. And it's highly recommended for all of us to get booster shots according to CDC guidelines, and you can go to cdc.gov. So again, if you've been vaccinated with only one shot, and that was over 4 months ago, you're not receiving the full protection of the vaccine against the virus, okay? So you need to get vaccinated again and get your booster shots. Okay, now unfortunately, Omicron, the mutation, the variant of COVID-19, is still rapidly spreading throughout the United States and is highly contagious. And on August 26th, there were over 100,000 cases reported of COVID-19. Again, that's an underestimate because some of us we self-test ourselves with a rapid antigen test at home, and those numbers are not counted. And as of August 26th, there have been, on average, 477 deaths per day. So we are still in the middle of this pandemic. We don't know if the virus will continue to mutate into a more virulent disease, more contagious disease, and we still need to be vigilant with regards to preventing the spread of COVID-19 disease. That's why we're doing this Pharmative Live. Okay, recently, I tested positive for COVID-19 disease. I had my last booster shot on April 23rd of this year. And my partner, Jimmy, and I attended a fundraiser for women's healthcare in Los Angeles that was headlined by Rosie O'Donnell herself. And that's a whole nother story that I might tell you about some other time. But there were a lot of people from the Los Angeles area there in the theater. And at times I had my mask on, at times I didn't have my mask on, especially when I was sipping on a drink, okay? I sort of became a little bit, maybe not as vigilant about wearing my mask, although I have to say Jimmy was really good about wearing his mask, and I wasn't. And I'm fairly certain that's where I was exposed to COVID-19, and most likely the Omicron variant, because approximately 5 days later, I started experiencing a sore throat and some congestion and some rhinorrhea, which is nasal drip from my nose. And I thought it might be allergies, as I'm allergic to the California pollen and I'm allergic to dust living in the desert. And Jimmy, my partner, looks at me and says, you don't look quite right. Maybe you should test yourself for COVID-19. So I did. I did a rapid antigen test at home, and sure enough, I was positive for COVID-19. And interestingly enough, Jimmy was positive as well, but never had any symptoms of COVID-19 disease. So I self-quarantined on the opposite side of the house as my symptoms progressed over the next few days. And I experienced a really severe sore throat, dry cough. And again, when you have a dry cough, it's almost like razor blades in your throat, very painful. Sinus congestion, slight headache, rhinorrhea. I never had fever. I never had confusion or what they call brain fog, and I never had shortness of breath. So I had a fairly mild case. Perhaps maybe slightly moderate, but sort of mild, slightly moderate, never had a fever. Okay, now what's also interesting enough, I used some supportive care medicines to get me through, my symptoms, and I'm gonna list them for you as a clinical pharmacist in a few minutes. But what's interesting also, 2.5 weeks later, I relapsed, and that's been reported by other people in the lay press and in the literature. People relapsing about 2 to 3 weeks later. The symptoms returned a little bit, but not as severe. So slight cough, slight sore throat, post-nasal drip, that's it. And then it took me about 4 weeks to really feel recovered. So to really get rid of that lethargy and congestion, it took me about 4 weeks to really recover from COVID-19. And I suspect it was the Omicron variant, although I was not tested specifically for which variant I did have. So for me, I'm glad to say the vaccines worked. I did not have severe COVID-19 disease, which is what the vaccines are for, to prevent that. I did not have to go to the hospital. And of course, I'm here live, so I didn't die as well. And I don't want to make fun of that. I just want to make everyone aware that the COVID-19 vaccines are safe and effective. They've been proven to be safe and effective, both in clinical trials as well as in the real world population. And we're fortunate enough to live in the United States where we can receive these vaccines for free. So if you have not been vaccinated as of yet, you really need to get vaccinated because it's the best way to prevent you from getting severe disease, especially if you're immunocompromised or in the category of a vulnerable patient population. You really need to get vaccinated and you really need to get your booster shots. According to the CDC guidelines, which you can go to the website cdc.gov to review. Okay, new fact. In the fall, sometime in September, possibly October, there will be a new bivalent vaccine, which will be produced by Moderna, as well as from Pfizer BioNTech, 2 different companies, producing a bivalent vaccine. What does that mean? This vaccine will not only provide protection against the original COVID-19 virus, sorry about that, but it will also provide protection against the Omicron variant. Very important. So in the fall, expect that we're all going to be asked to get the new bivalent vaccine, which will provide us protection throughout the year and the winter. Very important as we spend more time indoors, okay? It's very important that we not only get our COVID-19 shots, but we get our flu shots as well, okay? I strongly recommend, I wanna just shout out to Dwayne out there as well, I highly recommend to wear a mask, a KN95 mask, which are very comfortable to wear, or an N95 mask when you're on public transportation, planes, trains, subways, buses, or if you're in large indoor gatherings, or even large outdoor gatherings, because Omicron is highly contagious. I came down with Omicron, and I thought I was very conservative with regards to minimizing my exposure to the variant, and I came down with COVID-19 disease. But because of the vaccines, I was fully recovered. So wear your masks. I mean, that's the best way to not only prevent you from getting COVID-19 disease, but spreading the disease, especially to vulnerable patient populations. Okay. Now, if you test positive, the guidelines are somewhat confusing, but I talked to my doctor about this. When I had COVID-19 disease and I tested positive, I called my family practice doctor and I asked him a couple questions. And he said, once your symptoms resolve, well, self-quarantine immediately, and then self-quarantine for approximately 5 days, okay? And then when you go out in public, wear a mask. It's somewhat confusing, the guidelines, so again, use your best judgment, call your healthcare professionals. Now, there is an antiviral agent available for those people that are at high risk, and again, you can go to cdc.gov to see if you're one of those people that are at high risk to receive national emergency use of Paxlovid. I called my family practice doctor on the day I tested positive for COVID and started having symptoms, and we discussed this, and we decided I did not have those risk factors and that it was not FDA approved for COVID-19 disease, and he decided, and I decided with him, not to get national emergency use of Paxlovid. Most doctors and pharmacists can prescribe Paxlovid. So again, if you fall in those categories of high risk, of vulnerable patient populations, immunocompromised, elderly, people with pulmonary conditions, ask about Paxlovid. You need to take it within 5 days of testing positive for it to be effective. The second point I want to also make is if you're becoming short of breath, if you have your own pulse oximeter at home, they're actually very inexpensive. You can get one online for about $30, and you just clip them onto your fingertips, and they're a very sensitive way of measuring the oxygen level in your blood. And if your oxygen level is dropping below 90%, that's definitely a sign that you need to call your doctor and possibly go into the clinic or a hospital and possibly be evaluated for oxygen therapy. Now, as a licensed clinical pharmacist, this is what I'm going to recommend to you for managing some of the symptoms you have of mild COVID-19 disease, okay? For your sore throat, you definitely want a good lozenge, okay? A lozenge that contains dextromethorphan, which is a very effective cough suppressant that's available over the counter. I'm sure you're all familiar with it. And you want an anesthetic and an antiseptic. And a very common effective one is hexylresorcinol. And you can get lozenges that contain both hexylresorcinol and dextromethorphan, which is what I use to soothe my sore throat and to basically anesthetize my throat and prevent me from having cough. Now, for fever, I recommend generic Tylenol, okay? If you need an expectorant, generic guaifenesin, okay? Although the best expectorant is actually water. So keep yourself well hydrated. Guaifenesin sometimes makes people nauseous. So again, it's one of these things, some people feel better with it and allows them to cough up the phlegm, but other people get a little nauseous with it. So that's a question mark of whether you feel like you benefit from it or not. And then if you need a decongestant, all of these are available over the counter, phenylephrine. Now there are combination products that contain all three, generic Tylenol, generic guaifenesin, generic phenylephrine, or you can buy them individually. And oftentimes as a clinical pharmacist, I sort of want to treat your symptoms individually rather than take a combination product. You may be over-medicating yourself, like with guaifenesin, which is making you nauseous, but you need the decongestant and the Tylenol, so you might want to take those individually. Does that make sense? Okay, so I sometimes do like to take a combination product, like when I'm having major sinus problems, but because they're so easy and convenient to take. But sometimes you don't need all of the medicines in the combination products, and decongestants like phenylephrine can affect your sleep, so you don't want to take them at night. Okay, the last and final recommendation, drink plenty of water. Keep yourself hydrated. If you need to use something like Gatorade to maintain your electrolytes, please do that, because you may not be eating as much as you should be to maintain your nutrition. But again, and as our mothers and grandmothers used to do, have chicken soup. It's very soothing. It's very soothing to the throat. It allows you to get some nutrition, and it kind of allows you to basically, bring up some phlegm, and it just is very soothing to get you through the few days that you feel miserable. So that's my experience with recovering from COVID-19 disease. I'd be happy to hear if you've had an experience or a family member that's had COVID-19 disease, or for future topics for Pharmative Live, you can always reach me at info@pharmative.com. So in the meantime, stay healthy, as it's easier to prevent disease than it is to treat it. And don't forget to get your vaccination shots, both for COVID-19 as well as the flu. I'll see you next time.